Good afternoon to everyone. My name is Wei Hao, and today we are going to present COVID-19 awareness. In order to raise awareness about COVID-19, the first thing we need to understand is how dangerous is COVID-19. COVID-19 is dangerous because it is a virus that has never been seen in any humans. So, absolutely, no one is immune to it. That added to the fact that it spread as easily from person to person as influenza and infects the upper respiratory system is what makes it so dangerous. Because the COVID-19 virus is found in the upper airway, including the mouth and nose, the infection can be spread through coughs, sneezes, puffing, and even likely even loud talking. Moreover, we are learning that infected people are unknowingly spreading the virus days before they begin to experience symptoms. Some may not experience symptoms at all. Neither SARS or MERS spread as easily or widely. Therefore, vaccine plays a very important role here, which we will talk about it later. Other than that, this virus is dangerous because itself is a master of deception. In the early stages of an infection, the virus is able to deceive the body. Coronavirus can be running rampant in our lungs and airways, and yet our immune system thinks everything is okay. Based on Professor Lanier from University of Cambridge, our body's cells start releasing chemical called interference once they are being hijacked by a virus, and this is a warning signal to the rest of the body and the immune system. But the coronavirus has an amazing capability of switching off this chemical warning. When you look at infected cells in the laboratory, you cannot tell that they have been infected, and yet tests show that they are screaming with virus. And this is just one of the joker cards the virus can play. Next, the mortality rate of COVID-19 varies depending on where a person is in the world, their age, and whether they have ongoing health problems. Mortality rates of COVID-19 are usually higher among older population. Although all age groups are at risk of contracting COVID-19, older people face significant risk of developing severe illness if they contract the disease due to physiological changes that come with aging and potential underlying health conditions. Besides older population, people who have obesity and other chronic conditions such as high blood pressure, diabetes, and underlying health, lung and kidney disease will increase the risk of severe infection. Children with underlying medical conditions are at increased risk for severe illness compared to children without underlying medical conditions. Current evidence on which underlying medical conditions in children are associated with increased risk is limited. Current evidence suggests that children with medical complexity, with genetic, neurologic, metabolic condition, or with congenital heart disease can be at increased risk for severe illness from COVID-19. The prevalence of this disease among older people who may lack strength owing to aging and the inability of some people with dementia to relate the symptoms they are experiencing. Add to the devastating impact the virus is having in nursing and care homes. Gender is another risk factor for COVID-19. Men are dying at higher rates than women. While doctors don't yet know why, research has shown similar patterns of cytokine overreaction based on age and gender with other coronaviruses. That's all from me. I will pass it to the next speaker, Vincent Che.
Hello guys, I'm Vincent. So I'll be talking about how does the COVID-19 spread or transmitted. The first way of coronavirus spreading is through the droplets and aerosol. Current evidence shows that the COVID-19 mostly spread from the infected person's mouth and nose. The way the virus is spreading from their nose and mouth is when they sneeze, cough, speak, sing, or even breath. This is because the air particle or liquid particle that contains the virus is spread out when the infected person is doing those actions, and anyone who stay within 1 meter from that person can be breathed it into their lungs. Besides that, the virus can sometimes be spread by airborne transmission. This is why the government highly don't recommend the people to join a party or go to the crowded places that contains a lot of people. The virus can spread easily in the crowded places where the people uh, are close contact to each other within minimum of 1 meter range. This is because we can actually see the virus with our own eyes, and virus can travel through the air particle, which will cause the healthy person to inhale it. People may also become infected by the surface transmission, which is happen when a person touching the surface that have been polluted by the virus, and after they touching their eyes, nose, mouth without cleaning their hands. Next. So next is the what are symptoms when we get infected. People who get infected by COVID-19 are mostly had a wide range of symptoms. The symptoms of the COVID-19 usually may appear in about 2 to 14 days after exposure to the virus. The common symptoms of COVID-19 is fever, dry cough, and tiredness. This group of people is still in the first stages of symptoms, which is easier to be take care by the doctor if they immediately do the body checking and infected test before the illness become more serious. The second stages of COVID-19 symptoms is headache, sore throat, diarrhea, and loss of taste and smells. This group of people will feel very uncomfortable to continue with their work compared to the first stages. These stages of people should quickly take responsibility to quarantine themselves and make appointment to see the doctor before they become the one who spread the virus to the others in the community. For the most serious stages of the symptoms is the difficulty of breathing, chest, chest pain, and loss of speech and movement. This group of people already in the most serious situation of infections, and they should be sent into the emergency medical care to make sure their life is safe. Next. So how to lower the risk from getting infected? The first way to lower the risk of getting infected is to keep our body clean, wash our hands frequently and uh, frequently every day. This is important because we always use our hand to do daily work, and our hands were touching so many surfaces that may contain some bacteria or virus. Secondly, we should avoid from crowded places and practice social distancing to prevent close contact with the infected person. This is because we can see or measure who is the one who already get infected, so it is better for us to keep our distance from unknown person. Furthermore, we should just stay in home rather than going out, because the number of times we going out will increase the chances of getting infected by the virus. If we truly wanted to go out for daily supplies, we should wear masks correctly to cover our mouth and nose, to prevent the virus transmitted directly from others to us. Next, we should check the daily news or report to avoid the area of infections. This is helping us to lower the chances of having close contact with the infected person in the area that news already reported as highly infected area. Lastly, getting vaccinated is also a way to lower the risk of infections. Because vaccines are a critical tool in the battle against COVID-19. We must not put off getting vaccinated just because of our concern about new variants. We should use the tools that we already have in our hands, even while the tools are still improving. It is better for us to proceed with the vaccination, even the vaccine may be somewhat less effective against some of the COVID-19 variants. We are all safe only if everyone is safe. Next, what do we do if we think we are infected? After exposure to someone who has COVID-19, we should call the COVID-19 hotline to find out where and when we are getting a test for COVID-19 infections. We can find the hotline online because different states in Malaysia have different hotline for calling. If the test is not available, we should quarantine ourselves and do not go to work, to school, or even to public places. If we are really needed for daily supplies, ask someone to bring us supplies and put it in front of the door to us to do self-pickup. Besides that, always keep at least 1 meter distance from others or even our family members to keep them safe from the virus. Next, do not forget a medical mask, to wear a medical mask to protect others, including our family members, and when we need to seek for medical care. Finally, keep our hands clean and monitor ourselves for any symptoms for 14 days. That's all from me. I'll pass to the next presenter, Ivan.
Good afternoon, everyone. So for this part of presentation today, I'll be taking over, which is why we should take the COVID-19 vaccine. So first of all, I'll briefly explain what is vaccination. So actually, vaccination is a simple, safe, and effective way of protecting people against harmful diseases, in this case, particularly COVID-19. So vaccine works before they even the virus even come into contact with them. It uses your body's natural defenses to build resistance to specific infections, and this will make your immune system stronger. Other than that, vaccines will train your immune system to create antibodies, just as it does when it's exposed to a disease. However, some vaccines only contain kill or weakened forms of germs or viruses or bacteria. They do not cause the disease or to put you at the risk of its complication. For this case, like the COVID-19 vaccine, you won't be tested with positive COVID-19 if you take the COVID-19 vaccine. So most vaccines are given by an injection, but some are given orally by mouth or sprayed into the nose. So this is briefly the concept of vaccination. So next I'll be going to the next slide, which is why is vaccination important? So vaccination has been a safe and effective way to prevent diseases and save lives. And now that is required more than ever because of this COVID-19 pandemic. Today, there are vaccines available to protect at least 20 diseases, such as influenza and measles and etc. Together, these vaccines save the lives of up to 3 million people every year. So in this COVID-19 pandemic, when we get ourselves vaccinated with COVID-19 vaccine, we aren't just protecting ourselves, but also we protect those around us. Some people, like those who are seriously ill, they're advised not to get the vaccine. So they actually depend on the rest of us to get vaccinated and to help them reduce the spread of the disease. So during this COVID-19 pandemic, vaccination continues to be critically important. The pandemic has caused a decline in the number of children receiving routine immunization, which could lead to an increase in other disease and death from actually preventable diseases. WHO or WHO, World Health Organization, essentially urged countries to ensure that essential immunization and health service continue. And in this case is the COVID-19 vaccine. So this is why it's important to take the vaccination. So in this slide, I'll briefly compare among the COVID-19 vaccine. In Malaysia, there's currently we are adopting 3 brands of COVID-19 vaccine, namely Pfizer, AstraZeneca, and Sinovac from China. For the AstraZeneca, is not mandatory. I mean, it won't be given unless you volunteer to get the AstraZeneca. So on the first chart, as you can see, the Pfizer and BioNTech, they provide the efficiency up to 95%. This is estimated roughly. And for the AstraZeneca, the effectiveness as of November 23rd, 2020 is 70%, whereas for the Sinovac from China is 50%. So all these 3 types of vaccines that are adopted by our country, Malaysia, actually requires 2 doses. For the Pfizer, the second dose is given 3 weeks after the first dose is taken. Whereas for the Sinovac, is given 2 weeks after the first dose is given. And lastly, for the AstraZeneca, is given 3 months after the first dose is taken. So moving on, I'll talk about what should we expect when we're getting the COVID-19 vaccine. So firstly, medical professional will best advise individual on whether or not or when they should receive a vaccine. So a health worker will administer the vaccine, and the person receiving it might and will be asked to wait for 15 or even up to 30 minutes before leaving the vaccination site. This is so that health workers can observe individuals for any unexpected reactions following vaccination. So, like any other vaccines out there, COVID-19 vaccines can cause mild to moderate side effects, such as low-grade fever or pain or redness at the injection site. These mild symptoms should go away on their own and within few days, so we shouldn't worry too much after taking the vaccine. For Malaysia citizens, in order to be eligible for the COVID-19 vaccine, you must be above 18 years old. And I believe that most of you have already known that this MySejahtera app from the government is important. So I believe most of us already know this, but for the sake of those who still haven't heard of this, I'll briefly state what is and how do we use the MySejahtera app to register ourselves for the COVID-19 vaccine. So in MySejahtera app, after you install the app from Google Play Store or Android app, Google Play Store or Apple App Store, you are supposed to register yourself with your IC, and then from the COVID-19 vaccine tab, you can actually, the process is just simple. You just press the register and you'll be asked certain questions, and then you just have to wait. Right now in our country, Malaysia, I believe we are slowly progressing to the second stage of the COVID-19 immunization program, which is for the elderlies with comorbidity. Elderlies in this aspect is those above 60 age. And those comorbidity, which means comorbidity in this way, it means they have those, for example, heart diseases, they are high-risk patients. For the first stage, which I believe some of the states in Malaysia has already gone through all the first stage, which is the frontliner. So now we are slowly moving to the second stage. So once you're eligible to get the vaccine, the government medical professional will call you to book an appointment. And when you are at the center, they'll actually tell you which brand of COVID-19 vaccine you'll be taking, so you will know what's injected inside you. So for the next slide, we have come to conclusion here. So before I begin the conclusion, I'll explain how were COVID-19 vaccines developed so fast. As most of us might be worried of this vaccine being developed so fast. Are they safe or not? Because before this COVID-19 vaccine, the fastest vaccines that came out that developed was, I think, only took 4 years. As compared to this, it's actually this COVID-19 vaccines is considered quite fast to be developed. So it's no surprise that most of us, we are worried whether if this COVID-19 vaccine is actually effective, safe or not. So how were COVID-19 developed so fast? So actually researchers were not starting from scratch when they learned about the SARS-CoV-2 virus, which is the virus name that caused the COVID-19. So this virus is actually a member of the coronavirus family. According to National Institute of Allergy and Infectious Diseases, there are hundreds of coronavirus, including 4 that can cause the common cold, as well as a coronavirus that sparkled the SARS, or severe acute respiratory syndrome, an epidemic back then in 2002, and also the emergence of MERS, or Middle East Respiratory Syndrome, in 2012. So Dr. Eric, I quote here, is an associate professor of microbiology at Albany College of Pharmacy and Health Sciences in Albany, told that scientists have been studying coronavirus for actually over 50 years. This meant that scientists, they have actually existing data on the structure, genome, and life cycle of this type of virus. So they are not starting everything from scratch. So this is understandable why that COVID-19 vaccine can be developed so fast to help to curb the COVID-19 pandemic, and hopefully that our life can be back to normal without having us to wear masks as soon as possible. So this is why COVID-19 vaccines can be developed so fast, and many developed countries, they spend a lot of money, millions or even billions of money into developing this COVID-19 vaccine to help to curb the pandemic. So in conclusion, the 2 key reasons that why we should get vaccinated are to protect ourselves and to protect those around us. Like I mentioned earlier, not everyone can be vaccinated. This include very young babies, those below the age of 18, or those who are seriously ill or have certain allergies, maybe allergies to the ingredient that made the vaccines. So they actually depend on others to get vaccinated to ensure that they are also safe from this COVID-19 virus. Other than that, in order for our country to be victorious over this COVID-19 battle, right now is already like 1 year over, and we have been through 3 MCO at different stages of the year. In order to be victorious over this COVID-19 battle, we must achieve at least 85% of population fully vaccinated. That being, we have taken 2 doses of the required doses. And right now, based on statistics from Google, which I checked a few days ago, is actually roughly only 1.8 to 2% of population fully vaccinated and be presented with the COVID-19 e-certificate. Of course, our government plays a big role in this, but so do us. To achieve this, every one of us must take part in the National Immunization Program, in this case, the COVID-19 vaccination program, to ensure that we protect ourselves and stay safe, and we also protect our loved ones. And personally, I actually would prefer taking the COVID-19 vaccine other than getting infected by the COVID-19. I believe everyone is the same, right? So lastly, this is the slogan by our government, which is Lindung Diri, Lindung Semua. In English, it means protect ourselves and protect our loved one with the help of vaccine. And we're moving on to the end of presentation here. So that is all for my part of presentation. And now we'll move on to the Q&A session. If any of you have any questions, you can just type in the Google chat box or open the mic. Thank you.
Okay, so I have a question. A good question about the vaccine amount, the vaccination. So about the vaccination, because we need no no we sorry. So basically, the 18-year-old below cannot take vaccines, and the allergies. So what do they need to take? So can they're just left out, or maybe there's another way to vaccine them?
So thank you for asking your question. So I'll help you by answering this question here. So as I mentioned earlier, this COVID-19 vaccine is actually only given to those above 18 years old. And so, like back to what I said earlier, those that they are not suitable to take they're not advisable to take a COVID-19 vaccine, they actually rely on others, which is us, the healthy ones, to get vaccinated so they don't get, get infected with the COVID-19 here. So, besides that, what they can actually do, even though they are not vaccinated, is to practice the standard of procedure, the SOP, which is wear mask when you go out, maintain social distance, and avoid big crowd gathering, and only go out to get necessity, and follow the SOP strictly by the government. This will certainly help to curb and reduce the spread of COVID-19 and make sure that they are those that the young one or the one that allergies, they are not at risk of COVID-19. Nothing can be 100% sure, even though when you have done all this preparation, even though like you have get injected with COVID-19 vaccine, there's still chances that you might be COVID-19 positive. Like if you remember the chart that I showed earlier, there's no vaccine that proved that is 100% effective. Even the highest one, 95%, who knows, there might be the other 5% that you will hit and you just get COVID-19. So back to answering your question. So for those that you cannot take the COVID-19, what you can do is to strictly obey the SOP set by the government. And also for the rest of us we can take the vaccine, we should really participate in this COVID-19 vaccine. So do I answer your question?
Yes, this is my answer. Thank you for your answer.
All right. All right, I think it's time to end the presentation and the Q&A session today. Thank you everyone for joining us, and I hope you learn and get any information about this COVID-19 where we give out the presentation earlier. So please stay safe everyone and practice the SOP by the government. And thank you everyone for joining us today.